Welcome to Inside ProMedica, your path to wellness. Brought to you by ProMedica Charles and Virginia Hickman Hospital, where your health is our mission. Each month, we bring you insights from leading medical experts, the latest advancements in care, and essential health tips to keep you and your family well. Let's get started.
This is Kathy Williams, and with me on tonight's program is Dr. Riccardo Giovannone, and he is a famous orthopedic surgeon here with ProMedica, and he is friendly known as Dr. Gio. A lot of you have probably heard of him or had someone be a client of his. Doc, appreciate you taking time out of your day to talk with us.
Well, you're welcome. Pleasure.
So, lots going on with orthopedics. Do you service all ages?
I do.
Okay.
I do. There are certain things in the younger age groups that we don't do or I don't do.
Okay.
But we refer those out when we come across them.
Okay.
Yes.
And are most of your procedures done right here at Hickman Hospital?
Yes, they are.
Okay.
Most of them are there. I also have privileges at Flower Hospital and Wildwood. So there's some patients that want to go there or for insurance purposes need to go there, and we'll take them there.
Gotcha. So when people are dealing with joint pain or arthritis, how can they tell if it's time to seek a professional opinion rather than doing all these home remedies that we try to do?
And that's a difficult question to answer sometimes because patients' pain tolerance is very different.
Mm-hmm.
And usually they start off with medications, like Tylenol, Motrin, things like that. Mm-hmm. And I think that if it starts to affect their quality of life and their gait is off and they have other joints that are becoming painful because of the way they're compensating, I think it's time to get in, just get evaluated. They need to understand that you're not committed to go when you go in to having surgery automatically.
Right.
Because we don't practice that way. We definitely like conservative treatment, especially at the early onset of arthritis.
Right.
The latter stages might be a different story, but it's always good to get a baseline and just kind of get an idea of what's going on because sometimes it might be something more serious and you just don't know.
Right.
You know, Dr. Google doesn't have all the answers.
No, either does ChatGPT.
Correct.
Yes.
They
don't know everything. Well, so much is done just by sight and touch, I would think, too.
Absolutely, 100%. I mean, I was taught back in medical school by my trainers, and they said, if you listen to the patient, they will tell you what's wrong with them.
Right.
And then you confirm that with a physical exam.
Okay.
And then x-rays if it's appropriate.
If needed, yeah. Yeah, because you could be walking funny thinking it's your knee, but it's really your hip.
Correct. Absolutely. I mean, many times patients will come in with knee pain and we'll examine them, and it's like, well, your knee moves very well. There's no swelling, no crepitance or anything like that. And then we move their hip and there's no motion.
Oh, gotcha.
And then we x-ray their hip and it's destroyed with arthritis or riddled with arthritis.
Right. So what kind of things do you recommend for people that maybe want to check out their home things first?
Well, I mean, diet and exercise are important. I mean, as far as, obesity definitely loads our joints significantly. And if you have even mild arthritis, that might be exacerbated by being overweight.
Right.
So definitely you want to exercise within reasonable amounts and based on your age and so forth. You don't want to start doing impact activities when you shouldn't be, but some kind of resistance exercises, endurance exercises like walking.
Water aerobics are awesome.
Awesome. Yep. Pilates and a lot of different options there. So definitely want to explore those. And then there are the medicines that you can consider as long as your primary care doctor says it's okay. Tylenol universally is well tolerated, but if you have liver disorder, then you want to be careful with that as well.
Right.
And then there's the anti-inflammatories, but not everybody can take them or can tolerate them.
Okay.
So you got to, confirm with your primary care physician first.
So your movement, your lifestyle, your, I guess, overall health all influences the pain that you might have associated with joint pain.
Absolutely. Other comorbidities definitely can influence that. I mean, some people already have back issues, and then a minor arthritic condition in their knee or their hip can be more intensified because of that. So definitely it's all influenced based on those other comorbidities.
Right. But you also do the basic broken arm?
Absolutely. Yeah.
The kids' sports injuries?
Constantly. Yeah. And the soft tissue injuries like ACLs and meniscal tears and shoulder labral injuries, things like that.
So it doesn't always involve surgery?
No, it doesn't. I mean, I would say a high percentage of the time it doesn't involve surgery, especially at the outset.
Okay.
And probably anywhere from 20 to 25% of the patients we see may need surgery, but a high percent don't.
Okay. So if they do end up needing joint replacement, how should they anticipate their healing time to take, or how do you figure that out?
Well, it's something we can't really predict.
Right.
I always tell patients, and when we're prepping for surgery for a total joint replacement, that physical therapy and the rehab afterwards is just as important as the surgery itself.
Okay.
If you don't do the rehab, or you're not motivated to push through the pain, then you're not going to have a good outcome.
Right.
Okay, so that definitely is influenced. So those more motivated patients and those who follow through with their physical therapy usually do well.
Okay.
Now, different areas that we replace between shoulder, knees, and hips, the recovery is very different.
Right.
With knees, those are the tougher ones. They swell more, they stiffen more, and they're more painful typically. So those take a little longer, and that can be anywhere from 3 to 6 months.
Okay.
Sometimes less, sometimes longer.
Okay.
So we're pretty aggressive about our physical therapy after surgery, especially knee replacements. Yeah. But we do physical therapy on all of them. Hips do the best, especially doing it from the front. We call it direct anterior.
Okay.
And it certainly, because we don't have to cut muscle.
Yeah.
And so they certainly have less pain postoperatively, less swelling, but they still will get it, and they recover faster.
Well, and they don't, I mean, you encourage people, they get up and get moving right away. They're
Correct.
not laying in bed waiting.
Right.
Like they used to.
Yeah, absolutely. We'd keep them in the hospital for days on end just to kind of control their pain and then get them up after their pain's under control. It's like, nope,
too late.
We're going to do it at the same time. You know, we're going to control your pain, but we're going to move you right away because it's for your own good. Because there are other complications they can get, like blood clots, pneumonia, and things like that, and we don't want that.
No.
They don't want that.
No, nobody does. You kind of touched on it a little bit, I guess, that, you know, everybody's recovery time is different, and the importance of having a plan. And so you kind of help them with setting up the plan of what they need to do at different stages, or the physical therapist helps determine that?
We definitely have to prep them and with that plan and what therapy might look like, because everybody's situation is different.
Right.
You have to look at what their home life is like. Do they have help during their recovery process? Do they live alone? What barriers do they have in their household? So we got to address all of those issues. Some patients can't go home after surgery because they don't have the support system in place.
Right.
So we have to look at alternatives like going to rehab temporarily and then home for independence. So we definitely have to address that, because if we're doing it after the fact, then they'll get into trouble, they'll fall, they'll break something, and then we're back in surgery. And obviously
Nobody
we don't
wants
want that either.
Yeah.
So all that's important. We all do the plan. We try to prearrange for home care if that's what they need. Outpatient therapy, we just have them touch base with wherever they want to go. We let them choose where they want to go because they'll have experience with a local facility, and then they'll prearrange that, and then we'll just write the prescription so everything is in order to start immediately after surgery.
Yeah, no, that makes sense. So what else would you like to touch on, I guess, would be my question. I mean, orthopedics is a pretty broad subject. There's lots of different kinds of surgery that you do.
There is. Sometimes the public doesn't know exactly what we do, what we cover.
Right.
They think that we might specialize just in one area or subspecialize in one area. But for myself, I do total joint replacements. I also do a lot of sports medicine. I've been team doc for Siena Heights for many, many years. Unfortunately, they are no more. So we do a lot of sports-related injuries, work-related injuries, ACL reconstruction, meniscal repair, meniscal removal, not complete removal, but partial removal when necessary, shoulder arthroscopy, elbow arthroscopy, ankle arthroscopy.
Wow.
So, and a lot of different fractures in various areas of the body. As far as the extremities are concerned. I don't do spine, and most orthopedic surgeons all orthopedic surgeons in this county don't do spine. So we refer on when necessary as well.
Right.
We also do hand surgery.
Oh, okay.
Trigger fingers, carpal tunnels, arthritis of the hand. There are limitations to what we might do and different tendon injuries that we might not take care of in the hand. And we know we have a hand surgeon who does come into town from Chelsea.
Okay.
So we refer to her, and she takes care of them and keeps them local. Because if we can take care of somebody locally, we want to continue to do that because it's more convenient for the public.
Right.
You know, I know my limitations, and I know when I need to, hold them, and I know when to fold them
there you go.
and send them on.
Yeah, there you go.
Yeah.
But it is important that especially if they have a good support system around them, to be close for the support.
Absolutely. And then the follow-ups and, some injuries and some things require more frequent follow-up. And if you're driving to Toledo or Ann Arbor, that's a little inconvenient, especially maybe in the elderly population.
Right.
Maybe some of them don't want to drive, so this makes
So how can they get a hold of you? If they want to get a consultation or
just call my office, 517-264-0756.
Well, thanks so much, Dr. Giovannone. Appreciate your time, and I've been educated.
Yeah, my pleasure. And if there's ever any questions, please feel free to reach out to me.
Okay.
Thank you.
That's it for this edition of Inside ProMedica, your path to wellness. We hope you've gained valuable insight into the exceptional care and services available at ProMedica Charleston, Virginia Hickman Hospital. For more information or to connect with our healthcare team, visit promedica.org/Hickman. Take care, stay well, and join us again on the last Tuesday of each month at 6:20 p.m. for another edition of Inside ProMedica, your path to wellness. You can also listen to these programs as podcasts anytime under the On-Air Audio tab at WLEN.com.